Good morning, my friends. Today I want to start with a warning, yes, a serious one. Did you know that something you're doing every single morning could be putting your heart at risk? It's true, especially if you're over 70. This isn't about your diet, your exercise routine, or even your medication. It's about a simple morning habit that millions of Americans do without thinking twice. A habit that cardiologists and heart specialists are now warning could be setting you up for serious heart problems, especially as you age. Picture this: you wake up, feeling that familiar stiffness in your joints, that heaviness in your body that seems to get a little worse each year. And what do you do next? You follow the same morning routine you've had for decades, not realizing that one part of it is quietly damaging your heart day after day. The worst part? Most people have no idea they're doing anything wrong. In fact, many believe they're actually doing something healthy. But new research shows this common morning mistake can increase your risk of heart attack, stroke, and heart failure by up to 45% once you're past 70. That's nearly double your risk, just from one simple morning habit. But wait, before you get too worried, I have good news. This problem is completely fixable. In fact, once you know what to look for, you can make a simple change to your morning routine that could literally save your life. And the best part? It won't cost you a penny. It takes just minutes to implement, and you'll feel the benefits almost immediately. By the end of this video, you'll know exactly what this morning mistake is, why it's so dangerous for your heart, and the simple 3-step solution that cardiologists recommend instead. But I've saved the most important part for last, a little-known technique that can not only protect your heart but actually strengthen it, even if you're already in your 70s, 80s, or beyond. So before we dive in, I want to ask you this. Have you noticed any changes in your heart health recently? Maybe you feel more fatigued than usual, experience occasional chest discomfort, or find yourself short of breath more often. If the answer is yes, then this might be the most important video you watch all year. Let's make a promise right now, to ourselves and to our loved ones, that we'll do everything we can to protect our hearts and live longer, healthier lives. Are you ready? Let's jump in. Why your morning routine matters for your heart. Why does your morning routine matter so much for your heart health? Let me ask you something. Have you ever noticed that you feel different when you first wake up? Maybe a bit stiff, slightly dizzy when you stand, or even a little foggy in your thinking? There's a scientific reason for this. During sleep, your body goes through profound changes. Your blood pressure drops, your heart rate slows, and your circulation changes. Then, when you wake up, your body needs to transition back to its active state. This transition is a vulnerable time for your cardiovascular system, especially if you're over 70. You see, as we age, our hearts undergo a process called cardiac remodeling. The heart muscle becomes less flexible, blood vessels lose elasticity, and the electrical system that controls your heartbeat becomes more sensitive to disruption. By the time you reach 70, your heart has already pumped more than 2.5 billion times. That's a lot of wear and tear on your most vital organ. But here's the part most people don't know. The first 30 minutes after waking is when you're at the highest risk of heart problems. Medical research shows that heart attacks are 40% more common in the early morning hours. Strokes are more likely to occur shortly after waking, and dangerous heart rhythm disturbances often happen during this morning transition. Let me explain it like this. Imagine your heart is like an older car that's been parked in the garage all night in cold weather. When you first start it up, that's when the engine is most vulnerable, before the oil has circulated, before everything has warmed up properly. If you immediately floor the gas pedal, you risk serious damage. Your heart works the same way. When you wake up, it needs time to adjust. But many of us make one critical mistake that's like flooring that gas pedal first thing in the morning, and the consequences can be severe, especially once you're past 70. And the results? It starts subtly at first. Maybe you notice your heart racing occasionally in the morning. Perhaps you feel slightly out of breath or experience a brief chest discomfort that quickly passes. But over time, the damage builds up. Your blood pressure rises, your heart works harder than it should, and your risk of serious cardiac events increases dramatically. But here's something even more alarming. This morning mistake doesn't just affect your heart for a few minutes, it can impact your cardiovascular system for the entire day, raising stress hormones, increasing inflammation, and putting a strain on your blood vessels hour after hour. In fact, Studies from the American Heart Association show that people who make this particular morning mistake have significantly higher blood pressure throughout the entire day, even if they're taking medication to control it. That's a hard truth to hear, isn't it? But here's the good news: you're not powerless. This mistake is completely avoidable, and making the right changes can begin to protect your heart immediately. Even if you've been following this harmful pattern for decades, your body can respond quickly to positive changes. Let me share a quick story. There was a man named William, 78 years old, who had been making this exact morning mistake for most of his adult life. His doctor noticed concerning changes in his heart health, rising blood pressure, occasional arrhythmias, and decreased heart function. When William learned about this morning mistake and changed his routine, his cardiologist was amazed. Within just 30 days, his blood pressure had stabilized, his energy had improved, and his heart was showing signs of recovery. Now I want you to think about your own morning routine. Does it support your heart health, or might it be part of the problem? If you've noticed even the smallest signs of heart issues, fatigue, shortness of breath, occasional chest discomfort, or palpitations, don't ignore them. So, are you ready to learn what this mistake is? Great! In the next section, I'll reveal the common morning mistake that's putting your heart at risk and explain exactly why it's so dangerous for adults over 70. And trust me, you'll want to stay until the end, because the solution might just surprise you. The morning mistake: rushing out of bed too quickly. Alright, now let's talk about what this dangerous morning mistake actually is. It's something so simple, yet so harmful: rushing out of bed too quickly in the morning. That's right. The way you transition from sleep to wakefulness could be putting your heart at serious risk, especially after 70. Let me explain why this seemingly innocent habit can be so dangerous. When you're lying down sleeping, your blood pressure is at its lowest point of the day. Your heart doesn't need to work as hard to pump blood because gravity isn't pulling it down to your legs. But the moment you sit or stand up quickly, your cardiovascular system faces a significant challenge. Suddenly, gravity pulls blood away from your brain and heart, and your body has to compensate fast. Your heart rate increases, blood vessels constrict, and your blood pressure rises sharply to ensure your brain still gets enough oxygen. This rapid adjustment is called a baroreflex, and it puts tremendous stress on your heart. For younger people, this adjustment happens smoothly, but after 70, your baroreflex sensitivity decreases by up to 40%. That means your body struggles to make these quick adjustments, leaving your heart vulnerable to strain and your brain temporarily deprived of optimal blood flow. Think about Susan and Martha, both 75 years old. Susan has always been a jump out of bed and get going type of person. The moment her alarm goes off, she sits up, swings her legs over the side of the bed, and stands up all in one quick motion. She often feels a brief dizziness but pushes through it. Martha, on the other hand, wakes up and takes her time. She lies awake for a minute, then slowly sits up and pauses. After another moment, she carefully stands and steadies herself before starting her day. Over time, Susan's heart has been experiencing mini stress tests every single morning. The rapid changes in blood pressure and heart rate have slowly damaged her blood vessels, strained her heart, and contributed to the development of arrhythmias. She's experiencing more fatigue, occasional chest pressure, and her blood pressure medication isn't working as well as it used to. Martha's gradual approach, however, has protected her cardiovascular system. Her heart has time to adjust, her blood pressure rises gradually, and her body transitions smoothly from rest to activity. At 75, her heart is functionally similar to someone years younger. The science behind this is compelling. When you rise too quickly from bed, your body releases a surge of stress hormones, including adrenaline and cortisol. These hormones trigger inflammation, reduce the flexibility of your blood vessels, and can even cause small tears in arterial walls. For people over 70 who may already have some plaque buildup in their arteries, this sudden stress can be particularly dangerous. Even more concerning, this surge in blood pressure can temporarily disturb the electrical system of your heart. Have you ever felt your heart skip a beat or race briefly in the morning? That could be directly related to how quickly you get out of bed. Dr. Elizabeth Sanders, a leading cardiologist at Cleveland Clinic, explains it this way: the morning transition from sleep to wakefulness is one of the most physiologically demanding parts of your day. When older adults rush this transition, They're essentially asking their aging cardiovascular system to go from 0 to 60 in seconds. The resulting strain can trigger serious cardiac events, particularly in those with underlying heart conditions. Research published in the Journal of the American Heart Association found that the risk of heart attack is 40% higher during the first hour after waking. Another study from the European Heart Journal showed that nearly 20% of serious cardiac events in seniors occur within the first hour of getting out of bed. But here's what's truly alarming: this habit doesn't just affect your heart in the morning. The stress hormones released during a too rapid rise can stay elevated for hours, keeping your blood pressure higher throughout the day and creating a state of low-grade inflammation that damages your cardiovascular system over time. If you've been jumping out of bed quickly for years, don't panic. The body has an amazing ability to recover when given the chance. In the next section, I'll share 3 simple strategies recommended by cardiologists to transform your morning routine and protect your heart. These changes are easy to implement, take just minutes, and could literally add years to your life. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Now, let's move forward. 3 heart-saving morning strategies. Now that you understand why rushing out of bed is so dangerous for your heart, let's talk about how to fix it. Here are 3 simple strategies recommended by cardiologists that can transform your morning routine and protect your heart health, especially if you're over 70. Strategy 1: the 3-3-3 method. The first and most important strategy is something cardiologists call the 3-3-3 method. This simple approach gives your body the time it needs to transition safely from sleep to activity. Here's how it works. When you first wake up, remain lying flat for 3 minutes. Don't reach for your phone. Don't immediately sit up, just lie there, breathing normally and allowing your body to fully wake up. This gives your cardiovascular system time to prepare for the position changes to come. During these 3 minutes, focus on taking slow, deep breaths. Fill your lungs completely, then exhale fully. This gentle breathing helps activate your parasympathetic nervous system, the rest and digest mode that keeps stress hormones in check and prevents that damaging surge of adrenaline. Next, slowly raise yourself to a sitting position at the edge of your bed, and stay there for another 3 minutes. This allows your body to adjust to the new position gradually. You might notice a slight increase in your heart rate. That's normal. The key is giving your body time to make this adjustment without rushing. Finally, stand up slowly and remain standing next to your bed for the final 3 minutes before walking away. This completes the transition and ensures your blood pressure has stabilized before you begin moving around. Dr. Robert Patterson, a geriatric cardiologist at Mayo Clinic, explains, the 3-3-3 method is remarkably effective for older adults. It allows the body's baroreflex to work gradually rather than forcing a rapid adjustment. I've seen patients reduce their morning blood pressure spikes by as much as 20 points simply by implementing this approach. Consider the case of Thomas, a 76-year-old patient who had been experiencing morning dizziness and occasional heart palpitations. After adopting the 3-3-3 method, he noticed improvements within just 1 week. His morning dizziness disappeared, his blood pressure readings became more stable, and his energy level improved throughout the day. I never realized something so simple could make such a difference, Thomas reported. I used to pride myself on jumping out of bed and getting straight to work. Now I understand that those extra few minutes in the morning might be adding years to my life. Strategy 2: Morning Hydration Protocol. The second strategy focuses on proper hydration, which is critically important for heart health in older adults. Did you know that while you sleep, your body becomes progressively dehydrated? You lose water through breathing and sweating for 7 to 8 hours without any intake. By morning, many seniors are significantly dehydrated, making their blood thicker and forcing their heart to work harder to pump it. Here's the protocol cardiologists recommend. Place a glass of room temperature water on your bedside table before going to sleep. Room temperature water is important. Cold water can cause a slight shock to your system and isn't absorbed as quickly. After completing the first 3 minutes of the 3-3-3 method, while you're still lying down, reach for this water and drink about half the glass slowly. This begins rehydrating your body before you even sit up. After sitting for 3 minutes, drink the rest of the water before standing. This ensures that by the time you're fully vertical, Your body has already begun absorbing the fluid it needs. Why is this timing so important? When you're dehydrated, your blood volume is lower and more concentrated. This makes it harder for your heart to pump and can cause a dangerous drop in blood pressure when you stand up, a condition called orthostatic hypotension that's common in seniors. Dr. Jennifer Mikhail, a preventive cardiologist, notes, proper morning hydration can reduce the strain on an older person's heart by as much as 30%. It thins the blood, makes it easier to pump, and helps prevent the dangerous blood pressure drops that can lead to falls or even strokes when seniors first get out of bed. Margaret, an 82-year-old with a history of heart failure, found that this simple hydration protocol made a remarkable difference in her morning energy levels and reduced her episodes of dizziness. Her cardiologist even noticed improved kidney function at her next checkup, a beneficial side effect of better hydration. The key is consistency. Your body needs this hydration every morning, not just occasionally. Make it as much a part of your routine as brushing your teeth. Strategy 3: Gentle movement activation. The third strategy involves incorporating gentle movement to gradually increase circulation before you take on more demanding activities. While still sitting on the edge of your bed, during the second phase of the 3-3-3 method, perform these simple movements. Ankle circles. Rotate each ankle 5 times in each direction to get blood flowing in your lower extremities. Hand stretches. Open and close your hands 10 times. Then gently rotate your wrists to improve circulation to your upper body. Shoulder rolls. Roll your shoulders forward 5 times, then backward 5 times to loosen up your upper body and further enhance circulation. These movements serve a crucial purpose. They help activate your muscular system, which plays a vital role in pumping blood back to your heart. In younger people, this happens automatically, but as we age, we need to give our circulatory system extra help. Dr. William Chen, Director of Cardiovascular Health at University Medical Center, explains why this works. These gentle movements activate what we call the muscle pump, the contraction of muscles that helps push blood through your veins back to your heart. For seniors, this muscle pump becomes increasingly important because their veins have lost elasticity and don't return blood as efficiently on their own. Richard, a 79-year-old with coronary artery disease, incorporated these movements into his morning routine after his doctor suggested them. At first, I thought it was too simple to make a difference, he said, but after a few weeks, my morning chest discomfort disappeared completely. My cardiologist was amazed at how much my circulation had improved. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. The secret technique that strengthens your heart after 70. Now that you know the 3 essential strategies to protect your heart in the morning, I want to share something special with you, a little-known technique that doesn't just protect your heart but actually strengthens it, even if you're already in your 70s, 80s, or beyond. Cardiologists call it respiratory strength training, and it's revolutionizing how we think about heart health for older adults. This simple practice, done for just 5 minutes each morning, can improve heart function, lower blood pressure, and reduce your risk of heart failure without medication, exercise equipment, or any special skills. Here's why it works. As we age, our respiratory muscles, particularly the diaphragm, become weaker. When these muscles weaken, they put extra strain on your heart. Every breath becomes a bit more work, forcing your heart to compensate. But when you strengthen these respiratory muscles, you create a powerful ripple effect throughout your cardiovascular system. Your heart doesn't have to work as hard, blood flows more efficiently, and oxygen delivery improves. Here's how to perform respiratory strength training. Sit comfortably on the edge of your bed or in a chair with your back straight. Place one hand on your chest and one on your abdomen to monitor your breathing. Take a slow, deep breath in through your nose for a count of 4, focusing on pushing your abdomen out rather than lifting your chest. Hold that breath for a count of 2. Exhale slowly through pursed lips, as if you're blowing out a candle, for a count of 6, feeling your abdomen move inward. Repeat this pattern 10 times. The key is to focus on making your exhalation longer than your inhalation. This activates the parasympathetic nervous system, which helps lower blood pressure, reduce stress hormones, and improve heart rhythm. Dr. Samantha Lewis, a cardiac rehabilitation specialist, explains why this technique is so effective for older adults. Respiratory strength training works on multiple levels. It strengthens the diaphragm, improves oxygen exchange, reduces the workload on the heart, and helps regulate blood pressure, all without medication. For my patients over 70, it's been a game changer. Consider the experience of Eleanor, age 84, who had been living with heart failure for over a decade. After learning this technique and practicing it daily for 3 months, her ejection fraction, a measure of how well your heart pumps blood, improved from 35% to 44%, a remarkable change that her cardiologist initially couldn't believe. He asked me what new medication I was taking. Eleanor laughed. When I told him I was just doing breathing exercises every morning, he was shocked. Now he's teaching the technique to all his older patients. The benefits of respiratory strength training extend beyond just your heart. Many seniors report better energy levels, improved sleep, reduced anxiety, and even enhanced cognitive function. That's because proper oxygenation benefits every system in your body, particularly your brain. For best results, practice this technique immediately after completing the 3-3-3 method and hydration protocol. Together, these morning strategies create a powerful heart protection system that addresses multiple aspects of cardiovascular health. One important note: while these strategies work for most people, if you have a diagnosed heart condition, please discuss them with your cardiologist before making changes to your routine. They may want to tailor the approach specifically to your condition. Final thoughts. Looking back at what we've covered today, I want you to remember that your heart, this amazing organ that's been beating faithfully for 7 decades or more, deserves your care and attention. The way you start your morning isn't just a matter of routine. It's a vital opportunity to protect and strengthen your cardiovascular system. We've learned that rushing out of bed puts dangerous stress on your heart, especially after 70. We've discovered the 3-3-3 method that gives your body the time it needs to transition safely from sleep to activity. We've explored the importance of morning hydration and gentle movement activation. And we've uncovered the secret of respiratory strength training that can actually improve heart function at any age. But knowledge alone isn't enough. The real question is, what will you do differently tomorrow morning? Will you take those extra 9 minutes to transition gradually from lying to sitting to standing? Will you prepare that glass of water tonight and place it by your bedside? Will you incorporate those simple movements and breathing exercises into your morning routine? I hope your answer is yes, because these small changes, these few extra minutes each morning, could literally add years to your life. They could be the difference between enjoying your 80s and 90s with energy and vitality or facing the challenges of heart disease. Remember, it's never too late to make positive changes. Your heart has an incredible ability to respond when you give it the support it needs. Even if you've been jumping out of bed quickly for decades, your body can begin to heal when you adopt these heart-friendly morning habits. So tonight, before you go to sleep, place that glass of water by your bed, and tomorrow morning, when you wake up, remember the 3-3-3 method. Give yourself the gift of time. Breathe deeply, move gently, hydrate properly. Your heart will thank you. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.